is estimated that in Spain some 2.5 million individuals meet the criteria for COPD. Early diagnosis is essential in mild and moderate phases when action can prevent progression to a serious disabling disease. A simple spirometry is enough to establish a presumed diagnosis and indicate a complete workup. The patient's quality of life will improve immensely if they quit smoking and begin exercising. People with COPD don't consider their symptoms as such, which is why Fenaer is coordinating the action plan to inform about what COPD is, how to diagnose it early, how to prevent it and keep it from becoming serious, and how to achieve the best quality of life despite the disease. COPD symptoms include cough, expectoration, fatigue, and mild, moderate, or serious dyspnea. If a spirometry were performed, it would detect diminished respiratory function. When it cannot be reversed with bronchodilators, it is called chronic obstructive pulmonary disease. It will persist, and we must prevent it from progressing and getting worse. Basically, it results from inhaling toxic irritants. The number one irritant is cigarette smoke, in 80% of the cases. All kinds of contamination, air pollution, contamination in the home, bleach, coal-burning stoves, etc. And above all, contaminants present in workplaces for professionals at risk. Welders, heaters, traffic police in cities with heavy traffic, miners, etc. All jobs where toxic gases of all kinds are being inhaled. Likewise, recurrent respiratory infections since childhood can lead to chronic bronchitis. Smoking sometimes causes chronic bronchitis, cough with abundant expectoration, and other times emphysema, ruptured alveoli, and fibrosis. Both obstruct airflow and lead to respiratory failure. Initially, respiratory restriction or insufficiency is compensated because we have what is known as functional reserve. A person can move up to 3 to 4 litres with heavy breathing while exercising, but at rest they cannot move even a single litre with each breath. This is the functional reserve that gradually diminishes in individuals with COPD. Decreased or limited respiration does not appear as respiratory insufficiency given the compensation previously explained. Respiratory failure exists when we exercise. We can't breathe enough. We become fatigued. In this case, the person can be said to have dyspnea because insufficient oxygen reaches the bloodstream through respiration. Spirometry is a test that measures the volume of air we are capable of moving or ventilating by breathing. Basically, it measures two things: the maximum volume of air we can move and the speed at which we do so, especially in the first second of the exhale. The person exhales as hard as they can after inhaling as deeply as possible. It is a simple test that, when repeated 2 or 3 times with similar results, is considered to have been properly done. That is to say, it has been corroborated. This is a screening spirometry. If the result is not normal, you should request that it be performed in a specialized service. If it is normal, we can presumably rule out disease. The cost is nominal, since almost all healthcare centres have spirometers, just like electrocardiographs and apparatus to measure blood pressure. It should therefore be a routine test. When the action plan for COPD, smoking and spirometry month was presented, the intention was, just as there is a nurse dedicated to diabetes or high blood pressure at every healthcare centre, there should be a specialised nurse to perform spirometry, educate in inhaled therapy, as well as the other aids available to respiratory patients. Although there are already some qualified services in healthcare centres, given their proven efficiency, these services and centres should be guaranteed. Such is the case of the pneumology service at the Hospital de la Princesa in Madrid, that has just been given the award for the best service in their field in Spain 2018. Spirometry could be performed at pharmacies, just as blood pressure is taken, and the price would be quite similar. It is a matter of convincing pharmacists that offering the service is appropriate. The action plan was presented in all the autonomous communities. By joining the actions of pneumologists, family physicians, nurses, physical therapists, pharmacists, patient associations, and national and autonomous institutions, COPD will no longer be a serious threat to people, and its impact on Spaniards' respiratory health will decrease exponentially. We will be delighted to have your collaboration in making the project known.